I'm with Dr. Barry Freydberg. He's a general dentist in the Chicago area, and he is also a lecturer for Sleep Group Solutions, which presents continuing education on dental sleep medicine. Dr. Freydberg, how are you?
I'm good, thanks. Good to talk to you again.
Thank you for joining us. Uh, Sleep Group Solutions sent out an announcement earlier this week telling us that the number of courses that they were going to present has increased from 50 this year to 70 next year. And I was just wondering if you had any idea of why this particular type of continuing education course is becoming so popular.
Well, it's the demand is there from the public, and the dental public is what I mean. The demand is there, the interest is there, partly, I don't know, ads, publicity, physicians talking, but sleep apnea has become a major, major issue, and we're best suited to be the ones to diagnose it, just like high blood pressure, oral cancer, just part of the fact that we see patients regularly, every 6 months. We're sort of the people who started screening them, and oral appliances have a major role in the treatment of sleep apnea. So put it all together, the demand's there, and the need for the knowledge is critical.
When you present a course, is there what kind of feedback do you get from your audience in terms of incorporating dental sleep medicine as part of a general practice?
Well, what I try to do is give them enough information to get started, everything they need to know in a couple of days to get started. And I want to use the word safely. You and I talked, I don't want to guess how many years ago, because I've lectured on technology as well as prepless veneers. So lecturing on sleep has only been about a year now, although I've been doing it for several. And when I use the word safe, the reason I started doing this is because I saw so many dentists treating sleep apnea without understanding that it's a disease. It requires the cooperation of a physician, and it's very frightening, legally and ethically. We see ads from dental laboratories, mailings. These are sleep and snoring appliances. And some of us were making snoring appliances for people with sleep apnea, not even understanding it, and never treating their disease or getting them to have their disease treated. The same with sleep apnea. Oh, they have sleep apnea? Let's make a device open their airway. Not understanding that we need to do it under the orders of a physician and under a sleep studies that have been read by physicians. So I felt a moral obligation, and since it's an interesting field and something great to learn, to spread the word. And Sleep Group Solutions has soup to nuts what you need to do it and to understand it. It's a very good program.
What do you feel like are the highlights of increasing the awareness level among dentists about dental sleep medicine? What are the main things they need to focus on?
Well, the first thing is to adapt their new patient and continuing care medical histories and patient discussions, and both new and old patients, to make them aware that sleep apnea is a problem. And we ask questions, high blood pressure, type 2 diabetes, fibromyalgia. There are a zillion diseases that are closely related to sleep apnea. So we look at the medical history as well as the snoring. Do you have sleep apnea? Do you have a CPAP? Has anybody told you you've ever stopped breathing at night? We look at all these things in the history, and then we break the patients down into, well, let me go back a moment. It's our responsibility, I feel, to screen and find out if any of these people need treatment. And some of our patients don't know they have sleep apnea. Some are snorers with sleep apnea and think they're only snorers. Some of our patients have CPAP machines and don't wear them. I mean, it goes on and on and on and on. But only about 2 or 3% of the population with sleep apnea are diagnosed and treated with it. That's not many. So it's our job to try to find them, save their lives, and our role is to help people with it.
You were talking about some doctors, for example, prescribing the wrong device for patients, that kind of thing. So obviously there is some awareness among dentists that this can be a source of income for their practice. Can you give us a general idea of how incorporating sleep medicine can be beneficial for a practice from a financial perspective?
Absolutely. The first thing we have to understand is that in 2006, the American Academy of Sleep Medicine declared that dentists or oral appliances should be the first line of treatment for people with mild or moderate sleep apnea. Those with severe, the first line of treatment, is supposed to be the CPAP. But people who can't wear the CPAP also become someone we need to try to help if it's appropriate. So one thing is it is lucrative. I mean, you do make a living doing it, but you don't want to be, greedy about it, because if the person's better off with a CPAP, which is still the gold standard, they should have the CPAP. But there are enough people out there to feed us revenue. It's physically a lot easier to perform this kind of dentistry than it is to do a crown on tooth number 18 on a person with a big tongue. And what I noticed at the American Academy of Sleep Dentistry meetings I've attended, the dentists tend to have an older demographic, very interesting, than the dentists at a general dental meeting. It's quite surprising. When I walked in, I was surprised to see I'm one of the younger dentists there, not one of the older dentists there. It's not a joke. And part of it is because we like to look for new things. It is a little bit easier to treat physically. And it's interesting about the class. It's a 2-day class that we do at Sleep Group Solutions. And I would guess, and I really, I've given it a few times. I haven't looked through the slides to measure it, but I would guess the actual dental part, where we're actually instructing the dentistry part, how to make the appliance, the impressions, the titrations, the bites, probably is an hour, hour and a half at the most. The rest of the 2 days is, what is sleep apnea? Medicine, working with physicians, reading sleep studies, when do you need to order one, getting letters from physicians ordering you to make a sleep appliance, medical insurance. The dentistry part is not hard, and it is lucrative. It's you have to learn it. You just can't go out and take impressions and make appliances.
Well, Dr. Barry Freydberg, I appreciate your time. When is the next seminar you present?
I don't have my calendar in front of me. I know in the fall, and I'm sure you can get it on the Sleep Group Solution website, I know I have 2 in Florida. There may be a third this year. I know I have 5 scheduled next year.